Thanks everyone. Thanks for coming in and tuning in today. Today we'll be going through the supported home information session supported by and hosted by Right at Home. Myself, Jeremy, the Director of Right at Home Southwest Victoria, Gabrielle, the Care Manager for Southwest Victoria, and also Melinda, the Head of Operations for Right at Home Australia. Today we'll be unpacking what these upcoming reforms mean for you, our clients and our care teams, and how Right at Home is helping to make this transition simple and supportive as can be. We do understand this is a very complex process and hope to take some pressure off you today. This webinar will not be able to cover everything. However, hopefully we can at least explain the structures and processes. So, why was change needed? The current aged care system has served many Australians well, but over its time, it's become very complicated. With 3 separate programs, each with their own eligibility, rules and funding models, for clients and families, this often means confusion, waiting times and gaps in support. For providers, it means more administration and less flexibility. The Supported Home program aims to simplify all of this, creating one consistent, person-centred model that makes it easier for older Australians to get care when they need it. So, a bit of the overview of the changes. Under the Supported Home reforms, the government is bringing together all existing in-home aged care programs into a single streamlined system, with the CHSP program to be introduced in July 2027. The aim is to simplify how services are accessed, funded and delivered, instead of navigating multiple programs and funding rules. Clients will have one consistent pathway where they need clinical care, independent support or everyday living assistance. This reform is about making care fairer, more flexible and focused on outcomes that matter to each individual. So what we'll go through now is how to access Supported Home, and Melinda will take over for me.
Thanks, Jeremy. So now we're just going to cover a little bit about how you access the Supported Home program. So this slide outlines the full journey an older person takes to access Supported Home. So it starts there with registering on the My Aged Care. Secondly, then dropping down to the purple box is where the senior will be triaged and an aged care assessment will be carried out to determine what their needs are and develop a support plan. Thirdly, then the assessor participates to bring that support plan together to really understand what that senior needs to support them to remain at home. Then a notice of decision is sent to the client, to the senior via mail, and the client is placed on the National Priority System. This is also referred to as the queue. The participant receives the funding allocation of at least one of the 8 classification levels that we'll step you through a little bit later. And this is based according to their assessed need. And then what the client does is they then go and search for a provider to be able to support them with these assessed needs. A My Aged Care referral is then obtained by the provider. The participant completes an income assessment and submits this to Services Australia. And then the participant enters into a service agreement with the provider. The provider will work with them to deliver a budget and set up a budget that will support them and to develop a care plan. And the provider then notifies Services Australia that the participant has commenced their care. So in terms of understanding what is the assessment process, the assessment process ensures each client's care is holistic and is person-centred. So it looks beyond just the medical needs, and it considers all those things on the slide there at the moment. So it looks at family support, your home environment, psychosocial wellbeing. The assessment leads to 2 key documents. One is a support plan that outlines the client's goals and recommendations, and secondly, that notice of decision that confirms the eligibility of the client and the classification level under the supported home program. Registered supporters are also available in the system. So some clients need extra help navigating the system because it can be quite complicated. So the registered supporters act as a bridge between the client, My Aged Care, and the providers. They're essential for the older Australians who may be vulnerable, isolated, or managing complex health or cultural needs. The goal is to ensure that every person, regardless of background, can access aged care in a supported and culturally safe way. And that's back over to you, Jeremy.
So the next slide we're going to go into is the clients, the HCP recipients, now the supported home participants. And we'll just talk about who's who from now on. So just this slide shows the overview of the client types. So as you see, if you were a grandfathered client, if you are classified now as a grandfathered client, you would have been made eligible or started your home care package prior to 12th of September 2024. If you are a non-grandfathered client, you would have been made eligible or after September 12th, 2024 or before 1st of November 2025. If you are a new supported home participant, you will be made eligible after 1st of November 25. We will talk about these 3 further. So what's known as the transition grandfathered client. The grandfathered clients are those already receiving care or have been approved and on the National Priority System before 12th of September 2024. From 1st of November 2024, from 1st of November 2025, they'll automatically transition into the supported home program with no change to their annual funding and with their fees protected. Importantly, these clients are financially protected under the No Worse Off guarantee for co-contributions. This means they won't pay more than they currently do under the old income tested care fee rules if that applied to you. All clinical care services remain fully funded by the government, while independence and everyday living services attract co-contributions, but overall clients will either pay the same or less than they currently pay if you currently had an ITF. Additionally, these clients keep their unspent home care package funds into the supported home program and their supplement funding, and if they had their hardship arrangements until these expire. And they maintain their lifetime co-contributions cap at $82,000. Next, we'll go to the transitioned non-grandfathered clients. So the non-grandfathered clients are those who were approved for a home care package after the 12th of September 2024 and before November 1, 2025, which is tomorrow. Some may already be receiving care, whilst others may still be on the National Priority System. From 1st of November 2025, which is tomorrow, they'll automatically transition into supported home with no change to the annual HCP funding they were allocated. However, their fees, what they originally had to pay in ITF or co-contributions as it's now called, are not protected, and they pay the same contribution rates as new supported home entrants. Their funding will now be distributed quarterly. Importantly, these clients receive many of the benefits they have under home care packages, but they are not financially protected under the No Worse Off guarantee regarding co-contributions. This means they will have the same lifetime contributions cap of $130,000 and pay the same contribution rates as the new supported home participants for everyday living and independent services. They will, however, as mentioned above, keep their level of home care package funding and additionally keep their unspent home care package funds, their supplement funding and their hardship arrangements. Now we'll go on to talk about the brand new supported home clients. So the new supported home clients are those who have entered the aged care system on or after 1st November 2025. They will receive services directly under the new supported home model and are not part of the transition process. They are assessed and funded entirely under the new rules. They will receive a funding classification between 1 and 8, 1 being the lowest and 8 being the highest. These clients will pay the new supported home contribution rates and have a lifetime cap of contributions at $130,000. Now, just to quickly go over the supported home funding. There are 8 funding levels for ongoing services. As I said, these are in classifications 1 to 8. So these levels for ongoing services in the new program are each tied to the client's care needs as assessed and recorded in the support plan and noted in the notice of decision. There is also additional funding provided if assessed as needed from the ATHM is assisted technology and home modifications pathway. There's also an end of life pathway and a restorative care pathway, which we will talk about more on soon. Each client's annual ongoing services funding is split into 4 equal quarterly budgets and allocated by Services Australia to your provider. 10% of the quarterly budget is allocated to care management and allocated to providers as a pooled fund for all their clients. From 1st November with the supported home program, clients can only roll over $1,000 every quarter or up to 10% of their quarterly budget into the next quarter. This encourages proactive care and prevents large unused balances. This system improves planning and reporting and ensures funding is available when it's needed and caps care management at 10% of each quarterly budget, keeping more funds directed to client services and more available funds for the wider communities to access this program. Okay, now we've got the supported home service list. We will get our care manager, Gabrielle, to chat about this.
Thanks, Jeremy. Now that we've covered what's changing, here's how services will be organised under supported home. There are 3 simple categories of ongoing services: clinical care, independent services, and everyday living supports. Let's start with clinical care. This is the first and most essential service category under supported home. These are the health and medical services that must be delivered by qualified professionals, such as nurses, allied health practitioners, or clinical specialists. The government will fully fund these services to make sure clients can safely manage their health needs at home. From wound care and medication management to physiotherapy, podiatry, catheter care, IV therapy, and clinical nursing care. Right at Home already delivers these services each day, either directly or through third parties. So this transition won't change the care experience, but it will make funding and access simpler. Independent services focuses on helping clients stay mobile, safe and confident in their homes and connected to community. These services cover personal care, exercise or therapeutic programs, respite, social and community engagement, and essential supports like transport. Unlike clinical care, independent supports operates on a shared contribution model. The key goal is in the independence category is to promote wellness and reablement, supporting people to stay independent for as long as possible. Everyday living supports is the third category under the Support at Home program. This includes supports like domestic assistance, meal preparation, and help with gardening and household tasks, and includes accompanied and unaccompanied shopping. Like independent services, services are partially subsidised, but in this category, clients contribute a larger portion.
Okay, now we're just going to go on to the 3 extra funding streams with Melinda to present this for us. Thanks, Melinda.
Thanks, Jeremy. So in addition to the ongoing services, there are also 3 extra funding streams that are available to clients under the program and the reforms. The first I'm going to talk to you about is the restorative care pathway. So restorative care essentially is short-term goal-based pathway that helps clients regain independence after an illness, a fall, or a hospital stay. This program is really directed at reablement, supporting recovery and rebuilding strength, just ensuring and helping that the client can get back to their activities and their independence and their everyday life as quickly as possible and as safely as possible. This category often overlaps with clinical and independence supports, meaning clients might work with a nurse or with an allied health team member as part of their restorative care pathway plan. However, for existing supported home clients, ongoing services must not be duplicated in the restorative care plan. So essentially, if you are on services for the restorative care plan and that pathway, you would not then tap into those same services under your level 5 or level 3 supported home program. The restorative care pathway can be assessed by someone not currently receiving a supported home service package. So these people can be assessed for ongoing supported home services after they've completed the restorative care episode, if it is that they are still needing additional support. So the funding available is around $6,000 per episode, and it will cover up to about 16 weeks of support. And you're able to have 2 periods of episodes, 2 lots of $6,000 worth of support in a 12-month period. The goal is essentially for clients to return to their usual routines and remain as safe and independent in their home. The next pathway is the end-of-life pathway, and it's a specialised stream within supported home, and it ensures that clients can receive compassionate and dignified care in their final stages of life. It provides up to $25,000 of support over 12 to 16 weeks, and it replaces the normal ongoing services budget. So if a client was on a level 6 supported home program, it would be paused. They would activate their 25,000 end of life pathway. And then if they needed to go back at the end of the 12 to 16 weeks, they would resume their classification that they were on, and they would then receive the funding and the subsidy back on the supported home program. So the supported home program essentially pauses when you activate the end of life. So it will fund services such as the palliative care nursing, respite services, and assistance to the family and the client. For instance, the same type of services such as domestic assistance, personal care, and transport. So the goal is simple. It's to help clients spend their final weeks at home surrounded by the people and the comforts that matter most. Reassessment for reclassification is available as well to clients that your provider will do at the end of an end-of-life program if the person is to resume back onto the supported home classifications. The final pathway is the assistive technology and home modification pathway. So the purpose of this pathway is to really help clients live safely and independently at home through assistive technology, aids and adaptive equipment, and essential home modifications. So who is for? The participants, it's for participants who need equipment or environmental changes to improve their mobility, their function, or their safety in home. So the type of supports would be things like mobility aids and bathroom modifications, ramps, rails, access adjustments, environmental controls and safety devices, and it also includes the professional assessments and installations that would be involved in this program. The funding arrangement is there is a lifetime cap of $15,000 per participant for assistive technology, and an additional $15,000 per participant for home modifications, with higher amounts possible for some transitioned home care clients if it is clinically justified, using their unspent home care package funds that they may have. There is also a $2,000 a year available for assistance dogs, which is automatically allocated every 12 months, but it must not be accrued or rolled over. The assistive technology in home modifications needs to be utilised within a 12-month period. And for some extensive home modifications or some complex cases and conditions, this may be extended to 24 months. Contribution tables. So this will actually give you a little bit of an idea of the classifications and the categories that Jeremy spoke of. So we have the grandfathered clients and the non-grandfathered and new clients. So as you can see on this table here, clinical care is fully funded. So the clinical care is the nursing, it's the allied health services that Gabrielle mentioned earlier. The independence and everyday living services do attract income and assets-based contributions, and this will be determined by Services Australia. So these co-payments are capped and linked to a lifetime contribution. The lifetime contribution cap for a grandfathered client is $82,000, and for a new or a non-grandfathered client, it is $130,000. It's a much fairer and clearer model, ensuring transparency and consistency across all the funding levels. It's important to note as well that potential hardship supplements are available for people who will not be able to make their co-contribution payments and who fit a certain criteria outlined by Services Australia. So the slide here really gives you a good overview of the category, whether it be grandfathered clients or non-grandfathered and new clients, and just the contribution that the government would pay or the client would pay based on the service type that they would be receiving in terms of the supported home program. Okay. I'll now hand it over to Jeremy for care management.
Thanks, Melinda. Appreciate that. Well explained. The next part we'll talk about is generally a hot topic in the home care package and supported home programs. It's the care management. So the care management, will be based on a client quarterly funding. Well, the client quarterly funding now includes 10% for care management distributed by Services Australia to their provider directly as a pooled fund for all clients. Care management remains a vital part of the supported home model, but now it's more structured and transparent. It covers care planning, service coordination, monitoring, review and evaluation, advocacy and support and education. This ensures providers can still deliver high quality oversight while preventing administration costs from reducing the funding available for direct care. So care management is done by your care managers or care coordinators, soon to be known as care partners, and there's been quite a dramatic decrease in the care management fees to 10%, which will provide more funding for the clients to use for care needs, which is a good thing. The unspent funds, we will go back to Melinda. Thanks, Melinda.
Thanks, Jeremy. So this table here is a really nice picture graph of just essentially how all the classifications work on the supported home program. So just in the first column there, the classification level is either if it's a supported home 1 through to 8, and it's just, we've nicely slotted in there how the level 1 HCP, level 2, 3 and 4 HCP slots into those levels of classification and funding. The annual budget is there in the first column, and that's broken down, as Jeremy said, the second column into the quarterly budget for the client. The care management fee that Jeremy has just talked you through is then outlined. And essentially what we probably want to draw your attention to here is the unspent funds, as you can see on that right column here. So each client's budget's been divided into the quarters. And what you will notice, and this is different from what is currently happening under the home care package program. What is happening now under supported home is that unspent funds will not accrue to an unlimited degree. So you'll see in the final column that this rollover cap is there. So essentially only up to 10% of the total quarterly budget, or $1,000, whichever is greater, will be able to be accrued in unspent funds. So you can see as well for the lower tiers that this figure here represents the 10%. So it's either 10% of the totally quarterly budget or $1,000, whichever is greater. So the intent behind this change is to provide flexibility while preventing the large unmonitored surpluses that have often occurred under the home care packages. I was reading, and in I think it was January 2023, there was $2.7 billion of unspent funds there. So this change has allowed some structure and some support to actually deliver some timely services to more people and more consumers. It's really important to note as well that any funds above the 10% limit are returned to Services Australia, and they're not held by your providers at the end of the quarter. This ensures that the system remains equitable and transparent for all participants. Unspent home care package funds will remain available, though, for transition clients to use as top-up ongoing services or to use for those assistive technology and home modifications I spoke to earlier. Pass back over to you, Jeremy.
Okay, thanks very much, Melinda. Well explained again. Now, we're getting towards the end of the slides, so I just would like to summarise what we've been over, just to try and help people comprehend it. Now, the system, it is complex. It is very complex and overwhelming, and that's why right at home we want to go beyond, and we want to receive phone calls and any type of questions, whether it be come into the office and have a chat. You know, our team's happy to go out and visit clients and families in their own homes to explain this process face to face and make sure every question is answered. But what I will do quickly is I'll just go over and summarise what we've been through today, just to drive home some points. Obviously, I just want to probably go on that again, is that this system is ever changing. It's a bit dynamic at the moment, so this is why I've left it to the very last day, because things are changing and they still might change. So all the providers out there are trying their best at the moment. So we are trying to keep up with the government initiatives and educate the community as we go. But yeah, to go over some of the things, accessing the program, as we said, you need to either call My Aged Care and ask for an assessment. You can also go through this via your GP, your health professional, hospital if you do go to hospital, and they can make a referral on your behalf. Or you can speak to your local aged care specialist officer at Services Australia. And they will be able to help you organise an assessment, and you'll be able to begin the process from there. The other things, just to reiterate, is a current grandfathered client who was in the system before September 12, 2024, and they had no ITF or no contributions. There will be no change at all to your circumstances. You won't have to contribute going forward unless Services Australia have indicated that you will, but if they haven't, everything will be as normal. For the grandfather clients with a ITF, an income test fee that is, who will have a co-contribution, the contribution that you will make as of October 31st, 2025, there's no worse off principle there. And everything else will be the same in terms of the funding and the services you receive. The home care package, non-grandfathered client with or without a ITF or a co-contribution, based on what Services Australia have let you know, you will pay a co-contribution as above, as we've previously described in that certain percentage range. For all new supported home participants who are in the system after November 1, 2025 or after tomorrow, you will have to contribute some percentage unless you meet the hardship criteria and are able to go down that pathway. And that will be through Services Australia once again. The funding, so all grandfathered and non-grandfathered clients will maintain their home care package funding. We really want to make that clear so there's no stress about that. The new supported home participants will be funded under the classifications 1 to 8, 1 being the lowest, 8 being the highest. So that will be dependent on your assessment when you're going through the eligibility. Services categories, as we spoke about, as Gabrielle spoke about, there's 3 different categories. There is the clinical side of things where there will be no contributions at all by anyone, and that's for your allied health services, your nursing, and so on. Then there's the independence category, which if you do have to make a contribution, there will be a certain category of contribution you'll make. Personal care, this independence is personal care, medication administration, social support, cultural support, transport and other therapeutic services come under that category. Everyday living, categories that come under that are domestic cleaning, lawn mowing and basic gardening, meal preparation and delivery. And that will attract a higher contribution for those who do have to make contributions. And then with the 3 extra funding pathways, they're obviously exclusive to your funding from either supported home or home care package. So there's a restorative care pathway, the assistive technology and home modification pathway, there's the end of life pathway, and obviously your provider and or My Aged Care can help you with those. And then, as we said, the care management fees, multiple providers, there's all different types of percentages, but it is now capped at 10%, and a lot more transparent for the participants/clients to be able to look at. And the unspent funds, as we said, with the grandfathered, non-grandfathered transitioned clients, they'll be able to keep their unspent funds and transition it through to the supported home program and be able to use it over all the 3 categories. Okay, so now we will go on to our question and answers time. So at the moment, it's a good thing we don't have any questions, so that means we've either covered everything. But just to let you know, if people do want to ask questions, if they either don't feel confident asking questions via this stream or they think of something later on, we're more than happy for you to call Right at Home. And we can explain the process face to face. Right at Home has a local office in Warrnambool, in 79 Liebig Street, next to Mac's Snacks. So more than happy for you to pop in, make a time, and we are more than happy to sit down and take you through the process. So if there's no more questions, I don't think there's any more questions coming through.
The only thing I'd just add to that, Jeremy, for everyone listening, is this is in the same way it was under the home care package. This is very much a consumer-directed program. So client choice is first and paramount. So just to echo, I guess, what Jeremy was saying there are, it's quite complex, the reforms. There's a lot of layers. And it is difficult. It's difficult for providers to get their head around it. So we can only imagine how confusing it can be for seniors to navigate their way through. So just to echo what Jeremy said, even if you're not a client of Right at Home, if you've got any queries or questions about the program or what it might look like and how it might impact you, the easiest thing to do is to just give them a call or pop in on site and just step you through the program and how it mostly impacts you. And we're available to do that, and there's obviously no charge or no obligation in terms of that. It's just a really good way for you to be able to get the information that's relevant for you at the time you need it.
Yep, no worries at all. Thanks, Melinda.
So I think, to sum it up, we know and we recognise that the support at home system can feel complex, even overwhelming. That's why Right at Home goes beyond phone calls and forms. Our team visit clients and families in their homes and explain the process face to face and make sure every question is answered. This personal approach is what sets us apart from other providers. We believe aged care should be compassionate, clear and human, just like the care we deliver every day. If you have a friend or family who needs our guidance, call us today on 03 45 10 8919. Or as Jeremy mentioned, you're very welcome to call into the office at 79 Liebig Street, Warrnambool, and I'm sure one of our team will be really happy to help you.
All right. Once again, thanks everyone for tuning in. We really do hope you've got something out of it. We do know it's complex, so always there to support the community if needed. Thanks for joining.